Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the CEO of Madaket Health, Eric Demers. Eric, how are you?
Great. Thanks for having me on, Jared.
I'm excited to have you here. Let's dive right into it. Tell us a little bit about your background.
Sure. I'm a career healthcare junkie, I guess. I've been in this business since straight out of grad school. Started really on the finance side of healthcare, moved more into the technology side over time, and then eventually been more on the operations side. I've worked in provider, payer, tech, consulting, international health, really jumped around. But my real passion is really about, how can we improve the system every little bit along the way. So when I look at opportunities later in my career as I move forward, it's really about what can I do to, leave the system better than it was before.
And for our audience that I feel like most people know Madaket today, but give us a quick overview of the company, where things are at today, what the core focus is, and then we'll dive into some questions related to the company and the space.
Yeah, happy to. The company was founded right on the premise of how can we automate some of the waste, administrative waste out of the healthcare system. The original founders came from the Wall Street area, and they had done some work in that space and tried to bring their concepts into healthcare of, why can't we do things better? Why is there so much paper involved? Why is there so much manual processes, so much redundancy? Really focused in on trying to help the providers and payers bridge that gap between requirements for them to be in business, right? Could be enrollment, credentialing, licensing, many different tasks from along that perspective. And traditionally, providers work with about 20 to 25 payers. It's a lot of redundancy in what they have to do with each payer in order to be compliant and be in business. Takes up a lot of their time. So, in today's world, there's really, a lot of good opportunities to improve their processes with technology. So that was kind of how we took our approach with Madaket Health. We took a SaaS platform, automated enterprise automation approach to it, and we've really, built that out in order to bridge that gap between both sides.
I want to make sure we focus in on interoperability a bit. It's a term that we've heard in healthcare for a number of years, but coming from the Vive conference a few weeks back, it seems like more than ever, we're actually starting to put some action to that term. So talk a little bit, in the instance of Madaket, but interoperability and the power of data.
So they really go hand in hand, right? So the data aspect is, as we've automated more tasks and opportunities and things that we do in our business over time, the amount of data we are collecting is immense. Now, how do we apply that data? How do we use that more effectively? That's one task. The other task is, how do we move that data from one system to another? Many times, right? There's a lot of different challenges and opportunities in healthcare, right? There's moving automated data from one system to another. There's putting a lot of manual data and getting that moved over to a system. And over time, we feel as though there's been a lot of movement on improving interoperability, I should say it that way, in the space, and it's been more focused on using some more standards approach to doing that in the last decade plus, or really the last few years. So as we move forward, I think with the amount of automated data that's available today, we should be able to make some big leaps in the next few years in terms of how we can take that data and apply it most effectively to whatever your focus is within the industry. And I think that's really going to allow us to start to peel back and get to the root cause of some of the challenges that we have today, whether it be on patient care, operations, compliance, quality, et cetera, as you dig into it and be able to and then apply, next stage technology on top of that, whether it be more of a machine learning or AI type of tools in the future.
And talk a little about the role automation can play in things like making prior authorization easy. There's a lot of people, they hear that term, they start to cringe a little bit, right? Maybe not a little bit. Most people probably start to cringe when they hear that term. Talk us through, how automation helps, ease that pain. And then I guess also alleviating that whole payer provider abrasion as well.
Yeah, the abrasion is an interesting one because it definitely is real, right, in terms of how they both want the best outcome, but they're pushing back on each other to kind of achieve that outcome at times, which causes some of that abrasion When it comes to things like a prior auth process, the more you can automate the steps and bring the right provider information and consumer information over to the payer and meet what their requirements are, the faster you can get through that process. And there's no, in today's world, I mean, it can be a multi-pronged process, which is why it can be a little difficult at times. But with the amount of technology out there, there's definitely opportunities to start to, we'll say automate many, we'll call low-hanging fruit opportunities in prior auth, where it's not as complex, doesn't require as much, information required, steps required, and make sure we can start to achieve those. If we start to make some progress there, then I believe it'll start to alleviate some aberration between both sides.
And in particular to what you've been doing with Madaket, how has Madaket helped improve operations for? I know you're working with one of the country's largest healthcare clearinghouses, PNC. How are you helping them improve their operations today?
Yeah, on the PNC side, they've been a great partner. As they have tried to continue to build out their business over the years, and grown. How do we scale, right? And we used Madaket as an automation tool to help them scale, increase their business and flow without increasing a large team, right? So, by using the tool, we're able to actually, eliminate a lot of manual processing tasks that used to take, literally groups and groups and groups of people in order to effectively complete that task, get to a expected outcome for both sides. And now they can do it with a scaled back team and do much more volume through the system, help track, manage. Everyone can see where it is on all sides. Truly, advance their side, so it saves a lot of money throughout the process. It speeds up the process, so the outcome comes much faster. Ultimately, which then leads to happy clients, right? Because their clients are largely providers in this case, who are focused on faster. When this might be EDI enrollment transactions or some other type of enrollment process, so they get paid accurately, timely, in automated fashion.
And I know there's probably a lot that excites you about where the business is heading, but if you had to kind of name a couple things, what are you excited about moving forward with Madaket that you want to share today?
Yeah, there's a lot actually, but there's one I'd say for our focus this year. It's really around helping, bridge the gap a little bit between the payers and the providers with respect to the No Surprises Act, and how is that supported. It's probably the way to say it. Madaket, because of all the work it's done through the years, has become quite a large data organization as well. So we have a very large and robust provider data management assets and a lot of provider data in our system as a result of all the work that we've done on behalf of both sides. And right now we're moving and working more with the payers to help them improve their provider directories, right? It's a challenge for many providers to have clean, accurate information from the payers, from the providers, and get that in a timely manner in order to be compliant with what the expectations are. And if you're a consumer and you're calling up your payer and ask, how do my insurance company, I want to know where can I get, use a simple example, an MRI that I need to get done, and they have maybe 3 different location options. They should be able to tell you with certainty what the cost is to you as the consumer based on what insurance coverage you have. And that's where some of the challenges are today, because in order to do that, you have to make sure that the provider information is actually accurate, the location's accurate, it matches up to what's in network and not out of network, right? There's a lot of steps there. So we are actively helping organizations improve that so they can be compliant. And I think that's a really important step across the industry. And I think it's a really exciting step for us as we move forward into being able to support many aspects of the industry with the information that we've curated over the years.
Well, I'm excited, Eric, to stay in touch with you and kind of see the continued progress that Madaket brings to the table, as well as just staying in touch to always hear about the key industry trends and what's happening.
Cool. I love that.
I really appreciate you coming on the show today.
Awesome. Thanks for having me on, Jared.